Torch screening in pregnancy, when and why it matters. Hello everyone, this is Dr. Pranitha Reshmi, Fertility Specialist. Today let's talk about a test that creates a lot of confusion among pregnant women, that is torch screening. Before we start, let me ask you something very important question. How many of you have seen a torch report with words like IgG positive or IgM positive and immediately got scared? A pregnant woman comes in looking very anxious and says, Doctor, my torch test is positive. Is my baby okay? Will my pregnancy continue, or will there be any birth defects? So today, let's clear all these doubts. First, what is this torch? Torch is not one disease. It's a group of infections that can sometimes pass from mother to the baby during the pregnancy. So T stands for toxoplasmosis, O stands for other infections like syphilis, chickenpox, and a few others, and R stands for the rubella, C stands for cytomegalovirus, and H stands for herpes simplex virus. These infections in some situations affect the developing baby. Now here's my next question. Should every pregnant woman undergo torch screening? Many people think that the answer is yes. Actually, the answer is no. This is one of the biggest misconceptions. Current medical guidelines do not recommend routine torch screening for every pregnant woman. Why? Because many people will have IgG antibodies from infections they had years ago. That simply means your body has already developed the immunity. It doesn't mean that your baby is affected. Let's understand IgG and IgM in a simple way. Imagine someone has entered your house years ago. Your security camera has a recording that is IgG. It tells us that the infection happened somewhere in the past. Now imagine someone has just entered your house today. So the alarm starts ringing, and that is the IgM. That is similar to the IgM. It may indicate the recent infection. But even IgM is not always correct. Sometimes IgM can remain positive for months. Sometimes it can even be false positive also. That's why we never panic just by seeing the IgM report. We usually confirm it with the additional tests like IgG, VDT test, or PCR, depending on the situation. So when do doctors actually advise the torch screening? We usually recommend it only when there is a genuine reason. For example, if the mother develops a fever with rash during the pregnancy, or if the ultrasound shows abnormalities in the baby, like excess fluid in the brain, growth restriction, calcifications, or high drops, or if there is any strong history suggesting the recent infection. In these situations only, torch testing can help to identify the cause and guide further management. Another important message is please don't get a torch panel just because your neighbor had done, or because someone in your family has suggested it, or because you saw somewhere in the social media. So every test should have a medical indication. Otherwise, unnecessary testing may only increase the anxiety and expenses. So avoid close contact with the people who have active infection wherever possible, and simple precautions can make the big difference. Take home messages. So remember these 4 points. Number 1 is torch is like a group of infections, not a single disease. And number 2 is routine torch screening is not recommended for every pregnant woman. And number 3 is a positive IgG usually means the past infection and immunity, not danger to the baby. And number 4 is never interpret a torch report by yourself. Always discuss it with your obstetrician or fertility specialist before reaching to the conclusions. I hope I have answered so many questions. If you still have any further doubts, you can ping me in the comment box. We will meet in the next Facebook live session.